A very good day, my dear undergraduate students. The topic is staring at us. Now, let us not waste much time. I would like you people to kindly identify the structure. Also, compare it with the diagram that is given over here. I hope you can identify ciliated columnar epithelium and then the tile-like squamous epithelium. In this case, what are we seeing? I am finding stratified squamous epithelium, then the columnar epithelium, and again the stratified squamous epithelium. This is a diagrammatic representation of your columnar epithelium and the squamous epithelium. The same is shown in a histological picture from my rats. In this picture, I find that these are the columnar epithelial cells which are gradually being replaced by stratified squamous epithelial cells. So also in this, look at this gland completely covered by columnar epithelium, whereas in this, there is a columnar epithelium, then a stratified squamous epithelium on either side. This is a diagrammatic representation of the same basement membrane, columnar, squamous. Now, what are the points we should identify? Squamo-columnar junction, columnar cells being replaced by stratified squamous cells, basement membrane is intact, and there is an underlying smooth muscle over here. The diagnosis is squamous metaplasia. I would like you people to kindly describe it. This structure is rather rigid according to me, and there is an amorphous, irregular, basophilic material that is found in the media. So what I am seeing is a firm blood vessel which is having the intima, the media, the muscle, and the adventitia. Amorphous basophilic patches of calcification in the media. And there is a gooseneck-like outline of the blood vessel. I am finding the musculocollagenous tissue that is supporting this blood vessel. So again, another diagram that is showing you the basophilic material, and I would like you people to kindly identify the spindle cells, nothing but the smooth muscle cells. So the diagnosis is medial sclerosis or calcification. Can you people identify the structure on the screen? The blue arrow points out to a ballooned out structure, the glomerulus, which is a tuft of capillaries. Throughout the picture, I am finding multiple tubular structures. On my left, I find this green star representing a viable area. I am finding the nuclei in the tubular epithelium. On this side, you find that the tubules are all there, the shape is maintained, but no nuclei. These are all inflammatory cells that are seen. So, a definite line of demarcation, I hope you people can make the diagnosis. Kidney, because of glomeruli and tubules, nucleated viable area, ghost-like outline, no nuclei, and there is a clear line of demarcation. It is a case of coagulative necrosis kidney. I would like you people to describe the structure. So it is a very well punched out tubular structure. In the slide itself, you will be able to make out the outline. These are all lymphoid follicles, and this is the mucosa. The lumen is more or less stellate. Look at the star-shaped outline. That is getting ulcerated. So there is an ulcer, and all these multiple minute dots are all inflammatory cells. And they are traversing. This is the smooth muscle, and even in the smooth muscle, I am able to find the neutrophils. Externally, this is the serosa, and it is congested with the RBCs, the vessels. So, your points will be stellate lumen, ulcerated mucosa, transmural inflammation, mainly neutrophils, serosal congestion, and edema of the wall throughout. The diagnosis is acute appendicitis. Again, describe this picture. I am able to see multiple linear tubular structures. Some of them are having some RBCs. And always the pink background is the stroma that is supporting. Multiple proliferating capillaries with the stromal support. Some of the cells here are elongated with elongated nuclei. Proliferation of capillaries, loose fibrous stroma with fibroblast, chronic inflammatory cells. Look at these dots over here. Again, they are all lymphocytes. Chronic inflammatory cells are present. I would like you people to again identify. This is a capillary plump endothelial cell. This is a stroma containing the fibroblasts, and they are all lymphocytes. Look at this round, well demarcated cell, the lymphocyte. So it is a granulation tissue. Can you people describe it? First and foremost, I would like you people to identify the structure that is covering it. So this is the epidermis. There is an occasional ductal or rather the dermal adnexa that is there. But predominantly the dermis is being replaced by this ribbon-like folds. So here it is a larger magnification. I am finding multiple ribbon-like structures that are crisscrossing throughout. So that is the epidermis. The dermis is replaced by bundles of collagens. Here again, so it is haphazard in arrangement. There is no epidermis in this. We call it a bubble gum-like appearance or a chewing gum-like appearance. So skin with epidermis, bundles of collagen, random arrangement, a chewing gum appearance. That's a better word. No dermal appendages. The diagnosis is keloid. I would like you people again to describe. This will be better, a diagrammatic one. I am finding some larger, slightly irregular cells. This is an area, acellular, probably necrosis. These are round cells. They are supposed to be blue, but this is given diagrammatically. And there are spindle-shaped cells that are covering. All this you will not be able to see in a slide. For example, I am able to see multiple pale cells and they are having pale nuclei over here. The distance between the nuclei is the size of the adjacent cells. And this is the Langerhans type of giant cell with a necklace or a horseshoe pattern of nuclei. And these are the lymphocytes in the periphery. Look at this again. So the epithelioid cells, Langerhans giant cell, the lymphocytes. It is very well demarcated and explained. So this is the normal lymph node that I am seeing in the background. Sometimes in your slides, you'll be finding acellular region. That is the region of necrosis. With these giant cells, I should be able to make a diagnosis. The rest of it, you people should be able to describe. The capsule of the lymph node, lymphoid follicles, epithelioid cell clusters, which are large pale cells, Langerhans type of giant cells, necrosis, which is eosinophilic, acellular, and amorphous. The diagnosis, again, this is another beautiful picture showing the epithelioid cells. Look at this over here, well demarcated, and these are the points that you people will have to write. Sometimes there can be fusion of the adjacent granulome. The diagnosis is caseating lymphadenitis, tuberculosis. The next picture. Whenever you think of granuloma, there are two things. One is a tuberculous granuloma, another one will be good, a foreign body granuloma. Look at the giant cells, haphazard arrangement of the nuclei right in the center. There are plenty, more than 20-30 nuclei in the center. The cells are all large, irregular, and they are trying to devour or phagocytose something. In the background, again, the same story, small dark cells are the inflammatory cells. This is another picture, you may have it. So these are the cholesterol clips or crystals. This may be seen, or some suture material that is undigested can be seen, which is being phagocytosed by this. Such an area can be focused, and this is the collagen in the background. So fibrocollagenous tissue, multinucleated giant cells, cholesterol clefts, sometimes suture material, and other inflammatory cells. The diagnosis is foreign body granuloma. Again, a tubular structure, but this is larger. I'm able to make out the intima, the media, adventitial. So there is some adventitial vessel also over here. So in this one, I'm finding that there is something that is occupying the lumen, and there is a discontinuity in the endothelium. This is more fibrous, and there are some extravasation of RBCs that I can see. So people can say that there is a lines of Zahn I will be showing you. Sometimes what happens is this structure is called the thrombus, and there can be holes or canalization of this. So it is called as recanalization. Small blood vessels appear filled with RBCs, and the whole one is an organizing thrombus. So these points you people should write. So there is the endothelium, the media, and the adventitia are unremarkable. Adherent fibrous network is seen, entangled blood vessels, and you find small blood capillaries. There is a recanalization that can be made out. So it is an organizing thrombus. The same thing, it is just to show the lines of Zahn. I am finding alternate dark and light lines. This will occur in very large blood vessels. Organizing thrombus. This I hope you people are very familiar. I am able to see a capsule. The downward projection is called the trabeculae, and all this circumferential aggregates are all lymphoid follicles. And this is again a cut surface of a trabeculae. I am finding some structure in this. This is better, such an area will be focused for you. It is a trabeculae. There is an eccentric trabecular artery. Look at the RBCs over here. And then irregular map like brownish and bluish material that is there. And somewhat a congested lymphoid tissue in the back. So capsule, there is a trabeculae, trabecular artery. Along with that, there is a thickening of the capsule, congestion of the sinusoids, and the deposits. This is the most important thing, deposits of iron and calcium called the Gandhi-Gamma bodies. So the diagnosis is CVC spleen. Please do not go anywhere. Just wait for the next session. Question 3.